Information for professionals in educational settings. Children who have degenerative diagnoses and other medical diagnoses, such as a brain tumor or juvenile Huntington's disease, need a wealth of support. It is important for all professionals involved with the child to be educated about the child's diagnosis, to collaborate with other professionals in order to ensure best care, and to support the child's physical and emotional well-being. A child's ability to communicate may vary from time to time depending on the following: alertness, medication, memory, poor breath support, muscle weakness, hoarseness, word-finding difficulties, disease progression, fatigue, and/or sores of the mouth or airway. If the child is experiencing, for example, muscle weakness or hoarseness during the voice or message banking process, the recorded voice can be modified in order to compensate for the disordered vocal quality, which would result in a generated voice that best fits their natural voice. Furthermore, because of the aforementioned symptoms, augmentative and alternative communication use may be episodic or consistent, which should be kept in mind when choosing AAC strategies for the child. Speech-language pathologists should consider a variety of AAC technologies that address the affected child's physical as well as psychosocial needs. Some children may benefit most from voice or message banking, while others may benefit most from a non-electronic picture communication display. Whichever AAC strategies are chosen, it is important for the child to have access to them whenever possible to assist the child in communicating and connecting with the world around them. The following are communication themes often used by clinical professionals at Boston Children's Hospital. It is possible, however, that they can be implemented in educational settings as well, with the use of voice or message banking in mind. Number 1, support autonomy when possible. It is important for a child to participate in their plan of care. Voice and message banking allow the child to express their emotions and beliefs in a direct manner. Banking phrases such as "not now" or "come back later" can be beneficial because it gives the child a sense of control over their situation. A second theme to consider is provide care information and encourage the child's questions. Evidence points out that children who are provided with information regarding their health experience less anxiety and pain than their peers whom have not been as informed. A child asking questions about their medical care, treatment plans, and daily routines actually serves as a coping strategy. The next communication theme is support self-expression. Self-expression, according to John Costello, is achieved through the integration of the intended message, the words one chooses, the intonation and inflection of delivery, and the actual voice. Voice and message banking allow the child to maintain their identity, accent, and individuality that was conveyed with their natural voice. Because of this, the child is able to preserve a more personal connection with their caregivers, teachers, and peers. Another theme is vocabulary selection. Allowing the child to be part of the voice or message banking process allows you to achieve a more personal vocabulary set. At Boston Children's Hospital, there are 3 specific categories to consider when developing a vocabulary set on an AAC device: personality and social connectedness, psychosocial emotional needs, and medical care. And one final communication theme to consider is maintain social and emotional ties. Communication connects us with the world around us. Without it, feelings of isolation and loneliness often arise. One way children feel connected with their family and friends is by utilizing messages with personal meaning, such as "I love you" or stories or jokes they enjoy telling. Thus, it is important to consider these types of messages when choosing vocabulary and messages to include in the child's AAC device.